Good morning. It's a pleasure to be here at the Melanoma Patient Conference, and I'd like to thank Imogen, Susanna, and the team for my invite to present this morning. We're going to be talking about the gut microbiome. I've subtitled that, The Inner You That's Not You. So we're going to be talking about something that you carry around with you every day, but it's not made of human cells, but it's integral to how you function. So the discovery of immunotherapy was revolutionary for melanoma patients and also the people looking after them. My life is much better as a result of these treatments, as well as for many of my patients. And it also changed the lives of these gentlemen who discovered the checkpoints, the brakes that the immune system uses to control itself usually. And it's against those brakes that we work to ask the immune system to work harder to seek out the cancer cells. They won the Nobel Prize. So it's a very, very big deal. So why use immunotherapy? For lots of patients with advanced cancer in certain types, the treatment options are somewhat limited. You'll offer up something like chemotherapy to the patient, which will control the cancer for a period of time, but then the cancer cells will find a way around that treatment and become insensitive. And therefore you have to change the treatment and try again with something different to regain control of the disease. We know that that's not the way that immunotherapy works. There's potentially durable control with immunotherapy. Every day you're challenged by a number of immune threats, bugs, fungus, things that live in the environment, things that go wrong inside you. Your immune system's got multiple theoretically limitless targets, and most of the time you're not aware of all these threats and challenges because your immune system deals with those without you even being, aware or noticing. Evolution of the immune response could potentially keep up with changes inside the tumor cells if we can just teach the immune system to see the cancer. And therefore, that might mean control over a very long period of time, or possibly for the rest of the life of the patient, if we can do this in a way that works. So how does it work? So your immune system's watching all the time. It's always looking for problems. And it does that in two phases, two parts. So we know that there are cells that wander around your body the whole time, looking for threats, looking for problems, looking for infections perhaps, and showing the immune system those targets. So you'll see to the left of the diagram here, there's a green thing labeled a dendritic cell, and it is showing the T cell, which is the immune cell in the middle in blue, the target. It's demonstrating to that T cell what to look for. You'll see at the bottom of the left-hand side, there's a little pink molecule there labeled CTLA4 and a red thing stuck onto it called antibody. That antibody is ipilimumab. It works to turn up the surveillance that the immune system is going through, that it's looking for, to ask it to look harder for targets. On the right-hand side of the diagram is the effector phase. So this is when the T cell, the killer cell, if you want to call it that, goes out and attacks the target. In this case, it's a big pink cancer cell. And so it goes to look for the target that it's been shown already and destroys that target. And normally, in human cells, there are molecules on the surface of the human cells that say, don't attack me. Cancer cells come from human cells. And so those targets on the surface that say, don't attack me, might still be present and stop the immune system being able to target that cancer cell. And we can work with drugs in that space too. The thing that says, don't target me, is that PD-1 molecule at the bottom right-hand corner, PDL1, which is the green. Those things work together to have you not attack yourself inappropriately. Nivolumab and pembrolizumab work in that space, and they would be those red antibodies that you can see in that part of the diagram. So if we use pembrolizumab in the effector phase, or nivolumab, or ipilimumab and nivolumab together, we're working in both parts of the immune surveillance to try and ask the system to look harder, work harder, and find the problem. So why doesn't the immune system see it anyway? Well, as we've said here, the tumor cells can use some of the ways that your body understands itself to hide from the immune system. And depending on your frame of reference, that might either be a Klingon bird of prey or possibly a Harry Potter invisibility cloak, just so that they can go under the radar of your immune system. And we need to get around that problem. Why might the immune system see the cancer? Well, if it looks very unusual, if it looks odd, if it looks different than your normal cells have a message in them called DNA. And we know that changes in DNA can lead to the development of cancer. And we know that the more changes in the DNA there are, the more unusual that cancer cell will look to the immune system. And the fancy word for that is tumor mutational burden. So that's the number of mistakes there are in the DNA in the cancer cell. And it's different in different cancer types. So you can see here in this diagram at the bottom left-hand side are cancers that don't have very many mistakes, relatively speaking. And to the top right, there are very many mistakes. And you'll see that melanoma is running towards the top right-hand corner. Lots of mistakes in the DNA. Therefore, it's possible that the immune system can be taught to recognize the abnormal cells, the cancer cells, seek out and destroy. So what happens when we give immunotherapy to patients? This table here is the survival curve from patients in the Checkmate 067 study. This is a study where they gave ipilimumab, nivolumab together. That's patients in the red line. Nivolumab alone. That's patients in that turquoise line. And ipilimumab alone. That's patients in the black line. And you can see that the patients who did well with these drugs do really well. The dotted lines towards the right-hand side of the graph are the 6.5-year follow-up curves. So half of these patients are living with these drugs at 6.5 years. And in melanoma, that's revolutionary. My question, though, what happens to the patients who didn't do so well with those drugs? How can we change that number? How can we push those lines up to mean that we get more of those patients responding to the drugs in the long term for good outcomes? Now, the answer, of course, in the background is that us cancer doctors are running around looking for different drugs that we can add, more things to do for patients. But in the meantime, is there a way we can influence that with what we have to hand? Can the patients control some of their own outcome? Brilliant. If we can work together as a team, us prescribing the drugs and the patients changing something that they might be able to manage, maybe we could change the way that we have outcomes. You can see here, this is pembrolizumab data. The red and blue lines at the top are pembrolizumab, the green is ipilimumab, just to show you that also pembrolizumab patients do really well in the long term. So what else can we think of? The topic of today's talk was the microbiome. You might be wondering when I was going to get to it. Well, it's now. You're not entirely human. There are more cells in you and on you that are microbial, that are bug cells, than there are cells of your own in your whole body. You are a walking pot of bug soup, a big petri dish. I'm really sorry if anybody's having their mid-morning pastry and coffee at this point. You have microbes in every crease, fold, space, cavity in your body. So if you think about behind your ears, in your mouth, under your arms, all of these places have their own microbiome, and they're all built of slightly different microbes. Your body relies on the balance of those microbes to stay fit and healthy and well. And we know that when the balance of those microbes goes wrong, you can get problems. So you might get an infection behind your ear where the bad bugs outgrew the good ones and you need some treatment for that. You might get thrush in your mouth where the fungal part of your oral microbiome outgrew the other stuff and you need treatment to recorrect that. We think that the gut microbiome might be involved in driving some of our immune responses, and it's to that we're going to talk. Because if immune responses are important for cancer effects in immunotherapy treatment, then can we influence that inside? Can we influence that from the gut out? How do you get a microbiome? Did it just magic itself in there? Were you born with it? Well, no, it's an evolution. We know that the beginning of the microbiome is given through the placenta in utero as you're being grown. Your maternal donation of microbes starts through the placenta. We know how you are delivered changes what your microbiome looks like. Whether you're a vaginal or a cesarean delivery changes that. Were you a preterm baby? Were you born early? Were you born at term? those change your microbiome. Were you fed with breast milk? Were you fed with formula? Where were you brought up? On a farm? In a city? Who did you interact with? Did you go to nursery? What were you weaned with? When were you weaned? How much did you eat? How much milk did you get during that time? All of these things affect what lives inside your gut. By the time you're about 5, you have what resembles an adult microbiome. And that will then just evolve small amounts over time, unless you radically change your diet or have a course of antibiotics or some other points that we'll come to as we're going through. But effectively, your microbiome is settled by the time you're about 5. So what do they do for you? What do they actually drive? Well, we know that imbalances in your gut microbiome, what they call dysbiosis, can lead to gut inflammation. And for some patients, that might reflect an inflammatory bowel disease like Crohn's or ulcerative colitis. We know that that might lead to an increased risk of diarrhea, so IBS-type symptoms for some patients. We know it can change the way that your cardiovascular system is affected by the way that your fats are modulated. We know that having courses of antibiotics and what are described here as proton pump inhibitors, so those are anti-acid medications, can affect the growth of microbes in your gut and the distribution of microbes in your gut. We know that a good balance of microbes can increase antioxidant production, and we know that those are important in anti-cancer responses. We also know that it can improve your fat metabolism, reduce gut inflammation, increase your sensitivity to insulin and therefore diabetic control for some patients. So it's a hugely influential space inside you. It's been described as the undiscovered largest human organ. So if you want to think that you have a whole donated organ from outside creatures, that's kind of what we're talking about here. So why is it important with immunotherapy? So this complicated looking picture simply shows an experiment that was done to look at oral and gut microbiomes in patients who were going to have immunotherapy to treat their tumour. So they took oral and fecal, which is poo, effectively, swabs at the beginning of treatment, and then again at the end of treatment after they'd had immunotherapy. And they discovered, looking at the bottom part of the diagram here, that those patients who had a lot of different bugs inside their microbiome were more likely to respond to treatment and not progress than patients who had only a few or very little diversity inside their gut. So that's reflected in those parts on the diagram on the left that say high. So that's high diversity, lots of different kinds of microbes in the gut. And then on the right, you will see what this is, the percentage progression free. So that's patients who did not progress on treatment. And you'll see that those patients who had the high diversity, their curve is sitting a lot higher, meaning that they did not progress as much as the patients who had few or low amounts of gut diversity. So here it says lots of different microbes in the gut seem to offer the best chance of response when immunotherapy is given to a person. But it doesn't mean that you can't respond if you have intermediate or low. It's not absolutely restricted, but we know it might be the best chance. So how does that work? This is another experiment. And those little mice that you can see in the top right of the diagram in the laboratory do not have a microbiome. They don't have a natural microbiome at all. So what this team did was give little implants of melanoma tumours into those mice and then donate them a microbiome, a poo transplant effectively, from either a patient who was responding to treatment or a patient who was not responding to treatment. So patient in blue, the responder, had lots of different kinds of bacteria featuring things called firmicutes. That's on the top left of the diagram there. The patient in the right, the non-responder, had more Bacteroides. Those are bad bacteria, in inverted commas. The mice who got the transplants from the responding patients, their melanoma tumours did not grow. The patients who gave the mice microbiomes who were not responding to treatment, those mice had tumours that grew. So they were exactly the same as their donors. So we know that diversity is important, but also it seems that certain types of microbes are key to a response to immunotherapy. And the experiment we've just seen shows that mice who had transplanted melanoma tumours and no normal gut microbiome of their own responded in the same way as the donor of their microbiome. And in the experiment, the samples which allowed the mice to respond to the immunotherapy had more of the firmicutes and less of the Bacteroides. We know that high gut microbe diversity looks good, and we know that firmicutes are good. So how do we get them? The bottom line is that diversity in your diet produces diversity in your microbes. High dietary fibre, more than 30 grams a day, acts as a prebiotic. It's effectively food for the microbiome. So whole grains, beans, pulses, crunchy vegetables all offer up high dietary fibre. 30 for diversity is a little key phrase that people are starting to think about, where 30 different types of plant per week, and that can include anything, fruits, vegetables, herbs, nuts, spices, anything that comes from plant origin would be counted in your 30 for diversity. Lots of different colours, lots of different choices, increases the range of minerals, multivitamins, and things that are available to the microbes in your gut to grow. We also know that fermented foods can assist with diversity. Fermented foods are things that are produced by microbes, partly breaking them down out in the real world before you eat them. And we know that those microbes present are very much in a variety in those foodstuffs. Naturally, lots of different microbes live in things like kefir, sauerkraut, sourdough, and kimchi. They're not controlled in a way that some of the other products are, and offer up lots of diversity for your gut. So a diet that's got lots of these things in it should help with diversity. And here's to the thing that we were talking about with antibiotics. So antibiotics are necessary for some cancer patients, yes. But are they necessary for everybody in every setting? The answer is no, probably not. We need to be careful about who we give antibiotics to, because there's been several studies now, this is an illustration of one of them, where it shows that the patients who'd had antibiotics within 3 months of the initiation of immunotherapy, they're represented in the dotted lines, did less well than the patients who had not had antibiotics within 3 months of initiation of immunotherapy, and they're represented in the solid lines. So antibiotics can affect the microbiome. They change what bugs live in your gut, and therefore they might affect the efficacy of immunotherapy in the early stages of treatment. A review suggested 30% of antibiotics for outpatients weren't required. Some of those may have been given for viral infections or were given for temperatures that were actually not due to infection. Now, this study is complicated by the fact that many factors involved, other than the effects on the biome, might be confounding the outcome. So patients were less well anyway, or patients who needed antibiotics for other reasons. Those issues were not taken into consideration in the study because it's a limit of how many things you can consider when you're trying to work out what's important. So if you need antibiotics, please do take them, but it's always worth discussing with your team if they truly are needed, or if there might be another explanation for what's happening to you. Probiotics, these are things that we buy over the counter. They're capsules or drinks. They contain a single or very restricted selection of microbes which are thought to improve gut health by some individuals. In fact, these can narrow the diversity of the biome and were associated with reduced responses in a very small study of patients on immunotherapy. We also know that excess processed meats and significant intake of refined sugars correlated negatively with good diversity and actually increased the number of Bacteroides, those bad bacteria that you have. So maybe you are what you eat. Maybe it just requires a little bit of thought. We still have lots more questions than answers, and the biome is potentially able to be altered over time, but it's only one aspect in response to treatment and shouldn't be taken to extremes until we understand a lot more about it. Diversity comes naturally with a varied and balanced diet, and mental well-being is the key. If you really want that glass of red wine or the Mars bar is really the only thing that'll make you feel better that day, you're not going to do yourself a disservice by having those things. We don't want people to be extreme. We know that the diversity of your diet is important. Therefore, that means not narrowing it excessively. Here, enjoy yourself, but do think about what you put in your mouth. It might help our outcomes. And here's Cookie Monster, just to give you a little end to the morning. Thank you so much.